Hello everyone. In this video we will discuss on improved preparation in cell block cytology and its efficacy in diagnostic cytology. So, what is a cell block? A cell block is a cytologic preparation that compacts cytological material into a pellet and embeds it in paraffin. The cytologic materials are either from residual tissue fluids or fine needle aspirations. Cell block is a helpful addition to smears that will help providing a more definitive diagnosis, especially for categorization of tumors. For earlier methods for cell block preparation, it may use different types of fixatives, embedding techniques, and processing schedules. Thus, those methods may often have limitations including inconvenient, time-consuming, involving hazardous chemicals, and may lack better cell cytomorphologic characterization than smear. So, today we will explain further on modified cell block technique that will use improvised ethanol formalin fixative, which is nathan alcohol formalin substitute. Then, it will be followed by a simple paraffin processing schedule. However, the smears need to be prepared first before cell block preparation. This is because the smears can help for immediate assessment of cell morphology to identify the presence of abnormalities early. For FNAC specimens, 2 to 4 smears will be prepared using precarbowax-coated slides. Then these will be fixed immediately in 95% ethanol and then Papanicolaou stain. For excessive material and aspiration needles, it will be submitted to 50% ethanol for cell block preparation. Second, sputum specimens will be prepared by using pick and smear technique and followed by fixing in 95% ethanol and pap stain. Next, for effusion, brushing, washing and urine specimens will be centrifuged at 4000 rpm for 6 minutes. Then, it can proceed with direct smear or cytocentrifugation and followed by fixing and staining. Lastly, heavily blood-stained effusions. First, the blood needs to be removed by Fickle separation, which is a density gradient centrifugation technique. Then, proceed either with smear or cytocentrifuged. These will be followed by fixing and staining. Let's continue to cell blocking. Specimens that are used to make cell block obtained from excess materials after smear preparations, such as clots, tissues, or any residues within the needles or syringes. These materials are rinsed in 50% ethanol and centrifuged at 4000 rpm for 6 minutes. After centrifugation, the supernatant fluid is decanted. Next, collect the deposits and fix in freshly prepared nathan alcohol formalin substitute, NAFS, for 45 minutes. NAFS consists of 9 parts of 100% ethanol and 1 part of 40% formaldehyde. It is important to use fresh formalin solution since oxidized formalin can create artifacts, such as acid hematin pigments, also called formalin pigments. As you can see the picture here. The fixed cell pellets were recentrifuged at 4000 rpm for 6 minutes. Then, the pellets were wrapped in crayon paper, placed in cassette and stored in 80% ethanol until ready for processing. The processing of cell block involved 13 hours processing using automatic tissue processor. The cell block were embedded in paraffin and sectioned at 3 micrometer thickness. There are 3 types of stain that were used. Firstly, routine HNE staining, which provides clear visualization of general cellular morphology. It was used on all type of cell block sections. When necessary, histochemical stains were used to stain pigments, mucins, microorganisms, bacteria and fungi, and connective tissues. For more complex cases that require tumor cells identification or phenotyping, streptavidin biotin method will be used. Next is method of analysis. Both fine needle aspiration cytology, FNAC, and fluid specimens can be analyzed using cell block methods. Every smear and cell block slide were analyzed for cellularity, background, architecture pattern, and also cytoplasmic and nuclear details. They were reviewed separately and categorized into 4 groups based on final cytologic diagnosis, which is non-diagnostic when there is insufficient cells for a conclusive diagnosis, negative for malignancy, suspicious of malignancy, and lastly is malignant. Next, this is example picture from cell block and also FNAC smear from aspirate of cervical lymph node. First figure is FNAC that shows cells with hyperchromatic pleomorphic nuclei that diagnosed as metastasized SCC. The second figure is cell block from the same sample that also display the similar malignant features. Next, the sensitivity of cell blocks and smears. The overall sensitivity of smears is 87.9%, which is slightly superior to cell blocks, which is 78.2%. However, when smears were complemented with cell block, it can improve by 15.2% in the final diagnosis. The sensitivity of cell block are depending on sampling type, size, type of specimen and also aspiration techniques. The first factor that affects sensitivity of cell block is sampling type. Fine needle aspiration, FNA, and fluid aspiration are generally preferred because they preserve cellular structures effectively, allowing for accurate analysis. In contrast, brush cytology can cause cell fragmentation or damage, which may compromise the integrity of the sample and reduce diagnostic accuracy. Next, sampling size. Larger sample volumes provide a higher number of cells, increasing the likelihood of detecting malignancy. Conversely, small sample volumes may not contain enough tumor cells, leading to false negative results. The third factor is type of specimen. It is particularly effective for FNA specimens such as tumors in the breast, lung, and deep-seated abdominal organs. It's also effective for body fluids effusion. However, it is less suitable for cerebrospinal fluid, CSF, samples, as CSF typically has a low cellular content, making malignancy detection more challenging. Lastly is aspiration technique. Multiple passes during aspiration significantly improve the number of cells collected, leading to higher sensitivity. In contrast, a single-pass aspiration may not retrieve a sufficient number of cells, increasing the risk of non-diagnostic or false negative results. Advantages of modified cell blocks including enhanced diagnostic capability. The cytomorphologic features of cells in cell blocks resemble the appearance of cells in PAP smears. This will ensure that cytomorphologic details, such as nuclear and cytoplasmic features, are well preserved. Second, efficiency and safety. The cell morphology in paraffin-embedded sections is of high quality, matching the results achieved with B5 fixative, which is known for excellent preservation but is highly toxic. This eliminates risk of health hazards while maintaining high-quality cell morphology. Third, preserve cellular morphology. This method gives adequate clarity and delineation of nuclear and cytoplasmic details as it ensures that the features are sharp, well-defined, and easily observable, which is crucial for identifying abnormalities. Fourth, compatibility with staining techniques. Cell block sections are well suited for a wide range of additional diagnostic tests, such as histochemical staining and immunocytochemistry. Fifth, simple, reproducible, and readily adaptable. The method uses standard laboratory chemicals and equipment, making it accessible for most pathology labs. It is reproducible as the cell block can be used for various purposes. Lastly, loose cells, cell aggregates, and microscopic tissue fragments are easily recoverable. The use of the Nathan alcohol formalin substitute ensures that cells do not degrade or get lost in processing, preserving their morphology for histologic examination. Moving on to the next part, which is limitations of cell block. First, lower sensitivity compared to smears. For example, for FNAC, the sensitivity of cell blocks is 73.3%, meanwhile for smears 84.8%. Next, limited recovery in some specimens. It may not effectively concentrate cells, especially in specimens with low cellularity like fluid specimens, making it difficult to prepare effective cell blocks and potentially compromising diagnostic accuracy. Moreover, time-consuming as it involves centrifugation, fixation, and processing, which may require more time and resources compared to simpler smear preparation. Next, lack of standardization. Lack of standardized protocols across laboratories can lead to variability in cell block quality and diagnostic reliability. Finally, requirement for expertise. This is because thicker cell deposits required extra handling to ensure proper fixation. Cell block cytology has several important applications in diagnostic medicine. First, it plays a crucial role in tumor diagnosis and classification. Cell blocks are particularly useful for categorizing tumors when smears alone are insufficient. They allow for a more detailed evaluation of malignant and benign conditions, such as breast carcinoma, lymphomas, and metastatic tumors. Second, cell blocks enable the identification of infectious agents. Microorganisms such as Cryptococcus pneumocystis carinii and Aspergillus species can be detected using specialized microbiological stains on cell block sections. This enhances the ability to diagnose infections associated with certain conditions. Third, immunohistochemical phenotyping is another significant application of cell block cytology. By using a variety of antibody stains, immunohistochemistry helps identify cell types and tumor markers. This technique is particularly valuable for diagnosing cancers such as melanoma, carcinoma, and sarcoma. In addition to these applications, combining smears with cell blocks provides a significant diagnostic advantage. The overall sensitivity of diagnoses improves by 15.2% when both methods are used together. Furthermore, cell blocks facilitate histochemical and immunohistochemical analyses, which enhance the accuracy and classification of diseases. In conclusion, cell block cytology is an essential addition to traditional smear techniques, significantly enhancing diagnostic accuracy. It plays a critical role in tumor classification and the identification of infectious agents, especially in cases where smears alone are insufficient. The Nathan alcohol formalin substitute, NAFS, provides a safer and simpler alternative to hazardous fixatives like B5, while ensuring excellent cytomorphologic preservation. Combining cell blocks with smears improves diagnostic sensitivity and specificity, contributing to better outcomes in 15.2% of cases. Furthermore, the use of cell blocks allows for advanced histochemical and immunohistochemical analyses, which aid in precise disease characterization. Overall, this technique is a reliable, efficient, and indispensable tool in modern cytopathology, suitable for routine laboratory use. These are the references that were used. Thank you for your time.